Good day, folks. Today we're going to learn how to do a bed bath on JoJo the Caregiving Show. Now today's procedure is called a bed bath. We do bed baths for clients that are usually immobile, accident, injury, back problems, paralysis, these types of clients or residents. We may have to actually wash them in bed. So for the bed bath procedure, we're going to gather all the equipment we need first. Small face cloth, medium towel, and also we're going to need a large towel, and we're going to need a basin which we're going to fill with very hot water, 43 to 46 degrees, because it cools down so quickly. Also make sure you raise your bed up to waist level to prevent injury in the caregiver. And I already have Mr. Jones here ready to go. I have the bath sheet over him, and I've already removed his clothing. So you would take his clothing off underneath the bath sheet and put the bath sheet over top of him for privacy. So we're going to start off by doing the face. So sequencing for a bed bath is most important. As long as you're doing the proper sequencing from the cleanest part of your client's body to the dirtiest area of his body. So sequencing for cleaning your client would be the face, then the arms, then the chest, then the abdomen, then both legs, then the back, then between the legs, pericare, and then the last would be the anal area that you would do last, and then clothe your client, brush his hair, cologne, deodorant, whatever he prefers. Make sure he's safe before you leave the room. Okay, so we're going to start off with the face. Does not need any soap. We always do the far body part first and the close body part second. So we're going to start with the far eye. I do like to make a mitt like so. And from the nose to the outer area, and the other eye, nose to the outer area. Then we're going to do the ears, inside the ears, outside the ear, closest ear, same thing. Then forehead to far cheek, closest cheek, the nose area, wipe the chin, and make sure you get under the chin where bacteria and dirt can build up. Dry all that off for your client. Then we're going to proceed to move on to the arms. So I'm going to pretend that the far arm is already done, and I'll show you how to do the close arm. For privacy reasons, we're going to use the big towel. The arm goes underneath the big towel like so. And we can look at the body part now and say, what is the cleanest area of this body part? What is the dirtiest? So the top of the shoulder is the cleanest. The fingers, hand, and wrist is the dirtiest. So we're going to do long, firm strokes from the top of the shoulder down. Never ever go back and forth like this. You're just moving bacteria around the arm. You want to hold the arm at the joint and do long, firm strokes down to the wrist. 3 in the front and 3 in the back. Then soap is already in our water now, so we're going to do the axilla area under the arms. And then we're going to dry all of that off. Then we're actually going to take our basin and put Mr. Jones's hand right in there. Can you wiggle your fingers, sir? Thank you. Get him some circulation, some exercise. Clean his fingers, his hands, like so. Good time to offer nail trimming if you wait about 5 minutes so this swelling after it's been soaked can kind of calm down. You can trim his nails right now if you like. If not, you're going to continue. So now we have both arms done, and we're going to proceed to the next body part, which is the chest. So for the chest, we want to keep our client's privacy, so we're going to pull the bath sheet down, and we're going to leave the medium towel over the chest, and we're going to be as discreet as possible with our face cloth, soap, and water, and kind of go in on an angle. Clean the chest, under the breasts, looking for any discrepancies in the skin, rashes, bruises, things like that. Then we're going to do the abdomen, but we want to turn the towel first so we have proper coverage of our client for privacy, and we're going to move the bath sheet down a little bit more, like so. And then we're going to clean the abdomen, like so, and we're going to dry that off. After the abdomen is done, we're going to proceed to the legs, but we want to keep our client's privacy, so we make sure we're kind of doing this, discreetly pulling the bath sheet back up to our client's chin area. And then we're going to do both legs. And in order to do both legs, so I'll do the close leg. We're going to put the big towel under the leg itself. And it's going to be the same procedure for doing the leg. We're going to start from the cleanest part of the leg, which is the top of the hip, and go right down to the ankle area. And it's the same procedure. 3 long, firm strokes in the front. Maintain your client's leg by holding at the joint area. 3 in the back. Dry that off. And then we can actually take the basin and put our client's foot right in the basin. Now make sure your client can do this position with the leg bands. Check for position restrictions always. And we're going to wash our client's feet in between the toes. And we're going to clean that up. Always check the bottom of the feet. There's a black mark here, for example. Many PSWs and caregivers forget to check the bottom of the feet, so make sure you do that. Changing water is going to be your decision. Usually if it's dirty or cloudy or it's too soapy, you can change the water. I usually change it before the legs and after the legs, but that's going to be a decision you can make. And so after the legs are done, we're going to log roll the client onto their back. So we can do their back area now. Mr. Jones, I'm going to turn you onto your side. That's okay? Okay, thank you. Put the big towel right under your client's back, like so. And we're going to do long, firm strokes from the top of the back all the way down to their lower buttocks, okay? 5 strokes all the way down. Do not go back and forth. Just go straight down. Dry all that off. Would you like a back massage, sir? Not today? Okay, let's come back on our back. Thank you. And now our client's back is done. So now we can proceed to the peri area. Now again, positions restrictions may not allow you to do this position, the frog leg position, but please check if they can. It's much easier to clean your client if they can do this position. And you're always thinking about privacy, so something like this for peri-care between the legs. And for a male, we're going to start at the head of the penis in a circular motion 3 times around different parts of the cloth, like so, the shaft of the penis. Then wash the scrotums, and then in between each groins in a downward motion, cleanest to dirtiest, right? And then we're going to dry all that off. Very good. And the last thing we're going to do is turn Mr. Jones over again onto their side. I have to turn you again, sir. Thank you. And again, protect the bedding with the big towel that you have under the buttocks. And we're going to go straight up the buttocks from the urethra to the anal area 3 times, different parts of the face cloth. 1, 2, 3. Dry all that off and come back on your back now, sir, like so. So the bed bath part is basically done. Now what we would do is dress our client how they would like to be dressed. Cologne, deodorant as the client prefers. Comb their hair how they prefer. And if you're leaving the client in bed, please make sure he has his call bell and make sure he can use it on his proper side. And come back and check on your client regularly to see how he's doing. And then you put away all the equipment. And that's about it. Hope that was helpful. And I'll see you next time on JoJo the Caregiver Show.